we have been partnering with FAH for the last 5 years, and during that period we've done a lot in terms of ensuring that we change policy at the county level. We've done a lot of capacity building for our staff on various issues, both technical and non-technical. A key point is that when they came in, we had a challenge in our staff at the lower level in managing finances. And FAH was kind enough, we approached them and they agreed to train our staff on financial management. And I want to say that that was very timely because we had just enacted a legislation that allowed facilities at level 2 and 3 to manage finances. And there was a lot of increase in their finances, so meaning that without any form of training, it was a big challenge for them to really manage finances. So we used to get a lot of audit queries. But to date, because of that training, that came in handy, and we have sufficiently minimized the audit queries that are coming from that level.
We partnered with the Financing Alliance for Health the last 4 years, previously in Laikipia County. In Laikipia County, what we managed to do with the Financing Alliance for Health was, one, we developed our community health strategy, a five-year document that was covering, or that was to cover the year 2021 up to 2026. And then out of that strategy, we also developed a costing matrix for implementation of community health services activities. And we further moved and developed a bill we were to introduce to the County Assembly of Laikipia for purposes of mainstreaming and strengthening community health services. Then before I left in Laikipia, we were on the process of developing a financing strategy and also a financing mechanism for payment of community health promoters. And for Laikipia, we had 1,170 community health promoters that we are supporting at that time. And we wanted the county to start paying the stipend before even the national government. And I'm happy to report that, yes, the county actually managed to do that before even the national government came in to also pay their part.
In Nakuru County, we've been supported to hold our work plan validation meetings. That was basically in 2023, the annual work plan for 2023-2024. So we were supported, and through the annual budget, this is where we budget for all our activities, including community health systems budget, for onward forwarding to the national office, so that we are able to now get our support from the national government. Then the other area that we've been supported by Finance Alliance is we held a stakeholders meeting for community health, the first one in the county. It was quite an eye-opener because we brought all the stakeholders on board just to come and listen and see what our CHPs are doing, what the county is doing in terms of community health services. And that was a plus to us because it marketed our activities. It led to us forming a community health TWG. And so far we've been having our quarterly meetings with the TWG so as to strengthen community health services.
FAH has also supported us a lot in developing policies and guidelines. One key document that we have done it together is developing a document on community health services. That is a plan that would enable us to implement community health issues at the county level. Remember that we have a legislation, that is, we have a Community Health Services Act, but you cannot implement an act without having costed implementation plans. So FAH also came in handy in assisting us in developing a costed implementation plan that has enabled us now to start the journey of implementing the act that was developed by the department and enacted by the County Assembly. The other thing I would also want to mention in regards to FAH is that they have also been keen in advocacy. So one of the things that we noted that as a county we are not doing very well is advocating, especially now that we are closer to politics more than ever. So we've not been doing very good work in advocacy. So FAH has also been key in terms of one, training our staff on advocacy and also participating in that advocacy agenda.
When Financing Alliance came into Nairobi County, it was the very time when Nairobi was just about to start developing its Community Health Act. It was still a bill. So through the partnership, in collaboration with the other partners, we were able to deliver that. And at the moment, Nairobi County has the Community Health Act and is guiding how we are operationalizing community health in our county. Another area where we have also benefited from the partnership has also been in the annual work plan validation. This is an annual event that we normally do. We plan as a county, and once we plan, we bring together all our partners so that together they can declare their areas of partnership. So this is one area where we have also been bringing on board Financing Alliance for Health. At the moment, we have also been reviewing the Nairobi County Health Strategic and Investment Plan. It expired in the year 2018. It had not been reviewed. It's now when we are working on it. And the focal person for Health Financing Alliance is part and parcel of it. We benefit from the technical assistance.
In Nyamira, we currently have 1,379 community health promoters. And out of this experience of working with the Financing Alliance for Health, we lately are developing also a law, Community Health Services Bill for Nyamira County, a bill that is virtually borrowing from the primary health care law that was nationally developed, but customizing to our needs in Nyamira County.